Diabetes is a time bomb, and unless we take immediate action, it will kill millions of Americans and cost the U.S. healthcare system trillions of dollars. Type 2 diabetes is an imbalance between blood sugar supply and blood sugar demand. It's the fastest growing epidemic in the world and the greatest threat to human health of the 21st century. Diabetes is a leading cause of heart attack and stroke. Diabetes is the leading cause of kidney failure, the leading cause of leg amputations, and the leading cause of blindness. Every 10 seconds, someone dies from diabetes-related illness, and 2 new cases are diagnosed. The United States has 26 million people diagnosed with diabetes and 79 million people at risk of developing diabetes. In the United States, 1 person in 10 has diabetes. By the year 2030, it will be 1 in 5. By the year 2040, it will be 1 in 4. And by 2050, it will be 1 in 3. Millions of people will suffer, and the medical costs will be in the trillions of dollars. Trillions of dollars we don't have. Genetics plays a role in type 2 diabetes, but our habits make the situation much worse. We spend way too much time in front of our TVs and computers. Unhealthy eating begins at an early age and progresses steadily throughout adulthood, resulting in significant weight gain. The medical community does its best to help. First, they prescribe oral medications. Then they prescribe insulin injections. But the patient often winds up in a revolving door of pills, injections, trips to the doctor, and hospitalizations. Eventually, the patient's pancreas and kidneys fail, and they require a double transplant. They die 10 years earlier than someone without diabetes. This is an avoidable tragedy. It's not rational to try to balance blood sugar supply and demand only from the outside with pills and injections. We also need to work from the inside. Think of your blood sugar as a balancing act. On one side, you have blood sugar supply, and on the other, you have blood sugar demand. When you were younger, these were in balance, but things got out of whack. Most of us eat a typical American diet, which increases our blood sugar supply. And we're all getting older, which decreases our blood sugar demand. And many of us are not as physically active as we should be. That further decreases our blood sugar demand. And a lot of us have gained weight, which further decreases our blood sugar demand. So now, supply always exceeds demand, resulting in constantly elevated blood sugar, type 2 diabetes. What we need is a lifestyle version of the Swiss Army knife, a kit that contains all the tools that people need to reduce their risk of type 2 diabetes, or for those that already have it, to help manage it by controlling blood sugar supply and demand. I've developed such a kit. It's called the Baby Boomer Time Machine. Let me show you how following the advice in the kit can help restore blood sugar balance. Cooking healthy food will lower blood sugar supply, but most of us are too busy to learn about nutrition. The kit makes cooking healthy food easy by providing a cookbook full of excellent recipes. Healthy eating allows us to remove 1 cube from our blood sugar supply side. Cardiovascular exercise will increase our blood sugar demand. But the average person gets bored quickly with repetitive exercises like the stationary bike and the treadmill. The kit makes doing cardio easy by providing a DVD with short, fun, 30-minute workouts done 3 times a week. Regular cardio exercise allows us to add 1 cube to our blood sugar demand side. Strength conditioning will further increase our blood sugar demand. But the average person doesn't have the skill or the patience to create a home gym and lift weights. With the kit Strength Conditioning DVD, we'll get the same results at home in just 30 minutes, 3 times a week without weights. Strength conditioning allows us to add another cube to our blood sugar demand side. Weight loss will further increase our blood sugar demand. Most people try to lose weight by dieting, which, as you know, doesn't work. But the kit is a complete, easy-to-follow lifestyle program that will have us losing weight slowly and steadily. Losing weight allows us to add another cube to the blood sugar demand side. We've helped maintain a better balance between blood sugar supply and blood sugar demand. We have to get this kit out to the 26 million existing diabetics to prevent medical complications, and we have to get this kit out as soon as possible to the 79 million pre-diabetics. Once they develop type 2 diabetes, they run the risk of a life of chronic disease and an early death. We can help stop type 2 diabetes and defuse this bomb.